And now, Wellness Wednesday, brought to you by Dr. K.
In today's Wellness Wednesday, we're joined by Dr. Kira Tolson of Dental Care of Baltimore.
And she will be joining us every month for this segment, and we are happy that you're joining us. Thank you so much.
Thank you for having me.
So we're talking about dental health. We're not talking about like Lamar Jackson's grill that he wears with all the bling. We're not talking about that per se, but talk to us about like just dental health and why it's important to stay on top.
Sure. So a lot of patients come to me because they are missing teeth,
Okay.
or they come with missing teeth. And so I like to explain to patients why it's so important to replace missing teeth. Our back molars have been in our mouth since we were young kids. 5 and 6 is when we get our molars. And they do a lot of the heavy chewing. And so they're usually one of the first teeth to start deteriorating. And so a lot of people will come in with those missing molars and not think it's much of a big deal. But what ends up happening is over time your other teeth start to shift, because teeth want to touch, so the top teeth will start dropping down,
Oh, wow.
the back teeth will start moving forward, and then we'll have a lot of bite changes, right?
Okay.
The second thing is, as soon as you lose teeth, you start losing bone. And so what a lot of people don't realize, as soon as that tooth is pulled, they think no big deal, but then they start immediately losing bone in their jaw.
Okay.
And then the third thing is, like I said, these are our chewing teeth, right? So you lose your chewing teeth, then you put a lot of force on the smaller teeth, and then it's just like a domino effect. And the first domino to go is that big molar, and then they just
One at a
start
time.
one at a time.
Okay.
And so that's when people come in, when those front teeth start deteriorating. But
Okay.
it all started with those molars.
Got you. And so what are some of the options to replace them? I feel like the breadth of options has come a long way.
It has. So, you know, back in our grandparents' days, really dentures were the only options that people had for replacing teeth. And dentures are still a good option. Even dentures have evolved. The materials are a lot better. They fit more comfortably. But certainly a bridge is an option, which is something that doesn't come in and out. But really the standard of care today are dental implants. They're most like your natural teeth. And as I mentioned before, when your teeth come out, you start losing bone. Well, implants actually preserve jawbone, which dentures and bridges do not. And they function, you can floss and clean them just like your regular teeth.
I'm sure a lot of people are a little apprehensive about, they're self-conscious. So how do you go about assessing what might be the best option for any particular person?
Sure. So when patients come into my office, the first thing we have to do is take a CT scan, and that will allow us to see if they have enough bone, because you have to have bone to place implants. If you don't, that doesn't mean you can't get implants, but we have to do some bone grafting. Then, of course, we'll assess you medically to make sure that you're medically stable. But most patients are good candidates for dental implants and replacing their teeth.
And I think some people also put it off because they don't want to spend the money. So is this an expensive option? Does insurance cover any of it?
Yes, so insurances are, just because, like I said, it is standard of care now, insurances are picking up dental implants. So I would say the majority of insurances will at least pay a portion of the implants. And in our office, we also have flexible financing options to make it more affordable for patients to replace their teeth.
Okay. Well, Dr. Kira Tolson, thank you so much for being with us. And you'll be joining us every month with different topics for dental care and hygiene and all. So we thank you. And how do folks reach you?
You can call us at the office. We're at Dental Care Baltimore, Owings Mills.
Okay.
So my website is drkiratolson.com, or you can give us a call at 443-258-9939.
Thank you so much.
Thank you.
And we'll be right back.